Well, good Monday morning. I'm Ryan Kalei-Suji, joined by Yanju Denise, and thanks so much for tuning in this morning as we begin our week here all together and talking about vaccines, talking about the vaccination process and the new Safe Travels program and the amendments, I should say, to the Safe Travels program. Yanji, we're looking forward to the conversation we're having today.
That's right. And the person who is spearheading both the vaccine rollout and managing the Safe Travels program is Lieutenant Governor Josh Green. He is joining us from his office live from the state capitol this morning. Good Monday morning to you.
Good morning.
So let's start with the basics. Where are we at in terms of COVID in our community right now?
We're doing very well. We had 70 cases today, a total of 1,110 active cases, positivity rates 1.4%, and 45 people are in the hospital. To give you, I guess, perspective, just a week ago we had 65 cases, so compared to 70, we had 1,180 active cases. So we're down a little bit. We're down 10% in the hospital, and our positivity rate's falling. So we're moving in the right direction, and the 70 average is 8 lower than it was this time last week. It's 75.9 today.
Another thing that we want to obviously talk about specifically with you is the vaccination process. Where are things at right now? We know that last week the vaccine was made available to those 16 years and older. Have we seen a demand continue on through the week? And what are things looking like this week with people signing up for appointments?
There is good demand, although it's not demand like it was when we first came out of the gate and everyone was dying to get the vaccine. In this last 7 days, we did 96,529 shots this last 7 days. I went to both Hilo and Maui this week, Monday and Thursday, respectively, and saw a lot of young people getting vaccines. I gave a lot of vaccines to young people. So now we're seeing 16 and 17-year-olds getting the Pfizer. We're seeing people in their 20s and 30s getting shots. And that's important because we now have a different trend that we've seen. 70% of all cases are people under age 50. So that's an important statistic, and you can take that to the bank. So we've seen the trend away from our kupuna getting sick, which is fantastic because that will mean less fatalities and less severe illness. Although we have seen people in their 30s and 40s quite sick in the hospital. One even passed away. So that's been the trend. As far as the vaccine goes for the state, we now have done 1,161,471 shots. So we're almost at 1.2 million shots. And when we get, as you know, to 2 million shots, we will essentially have taken care of 1 million people, and that should be herd immunity. So we're making great progress. If we can keep this progress up and keep pushing the vaccine out at this clip of about 100,000 shots a week, in 8 weeks or so, we're going to be there.
Wow. So let's go back to that 70%, though. I want to hone in on that a little bit. Where are these folks? Where are you seeing that sort of community spread? What kind of activities is that linked to? And of those, there is this perception, and you did mention that someone had died, a young person had died. There is this perception that if you're in your 20s or 30s or even 40s and you get COVID, you can bounce back. Those hospitalizations that you're talking about, do those tend to be those younger people as well, or do they tend to be older?
We have seen a very clear trend that younger people are making up our hospitalized individuals. As of today, we have 45 people in the hospital, 13 at Queens, 8 at Hawaii Pacific Health, and 14 on Maui. And that makes the bulk of our cases up. And in Maui, we had a couple young people in the intensive care unit, one really at death's door. And so when you're seeing a 42-year-old or a 38-year-old get very sick, though it's a lower probability and much more rare, it's still happening. So these are not just statistics, these are people, these are heartbreaking circumstances, but we're not seeing outbreaks like at our nursing facilities like we saw during that 1 month on Big Island in Hilo. What we are seeing is a lot more cases from community spread through public gatherings, big gatherings, people being out without masks, catching the cases, and then a much rarer circumstance, but a circumstance nonetheless, that a young person ends up getting a really bad case of COVID and ends up in the intensive care unit. There's only a handful of people in the ICU statewide, and that's great. I think that we're seeing the really close to the end of larger number of fatalities from COVID in Hawaii, but we do still have to extinguish this whole thing. And so because we just opened a week ago today to age 50 and younger on Oahu, I think a lot of people in the next 3 to 4 weeks in that age category will get their shots. But it can't happen soon enough. We really need an urgency here because the sooner we knock down the total number of cases, there'll be less virus out there to spread. And with less virus, it's kind of a self-perpetuating prophecy. Then we will have more people vaccinated, less virus around, even harder to catch COVID, and the virus will die out. That's how this thing works. But we still need to go another, 800,000 plus shots. And we need to caution people, if you're young and outside, if you're anyone actually, still please wear a mask until we get through, this last bit of COVID, because there's already chatter about people not wanting to wear masks to move away from any mask mandates. But the longer that we can kind of keep the virus contained while we're vaccinating, the better. Remember what happened last July 4th weekend. That was very terrible.
Another headline over the past few days has been the Johnson & Johnson vaccine and it being cleared again to begin giving that vaccine to those who would like to choose the Johnson & Johnson vaccine. Is the state moving forward on that in releasing and administering the Johnson & Johnson vaccine? And are you at all worried that some may be hesitant to get that vaccine and that there may be a selection for others to just go with the Moderna and Pfizer and not take, that risk, if you will, of taking the Johnson & Johnson vaccine?
Yes, very astute questions. So here we go. It looks like we will begin to use the Johnson & Johnson vaccine again at people's will, totally optional. I think about Thursday. We are waiting for the federal description tomorrow about what they're going to put the warning label on. So what they're going to say is likely if you've had a clotting disorder or if you are a woman 50 years or younger, please be advised that there is a very low risk of clots. That's the thrombocytic condition that affects your platelets and causes 6 clots out of about 6.8 million people. It turns out that side effect is far less risky, although we don't like any of those side effects, than just the risk of not becoming immune. Hundreds of people died because they didn't get vaccinated, but only 6 people got that clot that was connected to the Johnson & Johnson. So they will recommend we resume it, but you asked, will people be reluctant or resistant? They absolutely will. There's a poll out there already that shows that 4 out of 5 people have some reluctance now to take that vaccine. The grander scheme of things should suggest that it is safe, that it is not any more risky than most other vaccines. 1 in a million is a pretty typical risk profile for a vaccine. And if you're in that age category and it's right there in front of you to take, certainly if you're a man, for which there were no individuals that developed that side effect, that clotting side effect, I wouldn't worry. But frankly, if people have any concerns, the Pfizer and Moderna are excellent and they should take those. On a personal note, that's exactly what happened with my family. Jamie, who's in her early 40s, has a birthday next week or 2 weeks from now. She was going to get the Johnson & Johnson, but then it was, suspended nationally. She was scheduled to get it. And then because it was on pause, they rescheduled her to take the Pfizer shot. So my wife, who's just over 40, ended up getting the Pfizer shot, and she'll get her second shot in 3 weeks. But I think that she and I discussed it, and we would have felt comfortable doing that shot if it's available. It's very good because it's convenient. It's one shot. You don't have to worry about a second shot. I think actually a lot of people will eventually want it. And we have 30,000 doses in Hawaii that are available. May very well be that we use that for walk-in clinics. I talked to Director of Health today about that. So we're going to try to increase our walk-in clinics, increase our easy capacity to get shots. But if people feel uncomfortable, that's half the game. If you are reluctant to get a shot or to take a medication, don't do it. Take the other one. It's totally fine. It's understandable. It's human nature. None of these vaccines are without any risk, but none of them also are, substantially risky that I wouldn't recommend that we take them for the safety of our community.
Stephanie's got a question. You mentioned your visit to Hilo and Maui. She says, can you talk more about your visit to Hilo in particular? What are you seeing in regards to vaccine demand on the neighbor islands? What challenges still remain in reaching herd immunity? Of course, the neighbor islands, just, the big island is, as its name suggests, very big. There are some people who may not be able to get from a more remote area. So what kind of outreach are you doing? And what do you say to Stephanie this morning?
Well, it is a great question. Because the Big Island's so large, we are having some difficulty getting into the rural areas. On that front, the Department of Health is reaching out to the rural areas. They're going to be doing some mobile vaccinations. They want to get out to places like Pahala, where they did a recent vaccination date, and they'll follow up with a second date. But it's going to take a lot of that because it's an hour drive from some parts of the south all the way up into Hilo or Kona. There was very good demand in Hilo. It was terrific to see several large sites that the Hilo Hospital is running. The community health centers are also reaching out and doing the job. We just saw a lot of different people coming in that hadn't done it before. Some old, no question. They were waiting. They had reasons that they couldn't get it before. They were undergoing treatment for cancer, for instance, and some people waited that I met. But then we had this young group of people who are 17, 18, 23, 27, who only recently had been offered the shot and were now scheduled. So I think that's what we'll see. And then actually there will be a whole nother surge coming up. In just a few weeks, I would expect that they will okay or approve the Pfizer vaccine for ages 12 to 15. And then probably school-based clinics and so on will begin to offer the vaccine, which is another way you get to herd immunity, because it's not just about adults, it's also about adolescents and ultimately children if people want that. Has to be safe, has to be demonstrated through research that it's not a problem, but that does appear where things are going. There are other places that will reach herd immunity sooner. For instance, Lanai and Molokai this week may very well reach herd immunity because they will pass the 70% threshold soon for vaccinations for society. Amazing what can be done in some places where there's a smaller population. Meanwhile, there's been a lot of vaccinations going on in Kauai. They've done a wonderful job with the program. But even with that, there were 14 cases on Kauai over the last several days of COVID. Almost all of them were community spread from a couple individuals, our own individuals that had traveled back from their vacation or work. And so 14 cases over the course of several days is not a large number. But on Kauai, they were so accustomed to having no cases that does raise, one's level of concern. Still, Kauai will probably be the largest island to reach herd immunity in the state, and that'll be not too long. It's amazing how they've progressed. The whole state, I'd like to see us at herd immunity sometime around July 4th, but there will be areas where, for instance, where I was the doctor in Kau, my patients there, the most wonderful people in the state in so many ways, are a little bit more reluctant to accept Western medicine or vaccinations or certain treatments. That's always been the case. They're just they have a different medical philosophy to a degree. So some larger percent, it'll still be most people will get vaccinated, but it might be 10 or 15% more that don't in certain rural areas. And that's always a problem when you're looking at a public health initiative, but it's something we respect. If people have a different belief system, we respect that in Hawaii, and we'll do what's necessary to encourage other individuals to get vaccinated so that we reach the threshold.
We wanted to spend some time to talk about the Safe Travels program and the changes that are coming because of this new vaccine verification process or exemption process with travel between the neighbor islands. That announcement, of course, came through last week. If you can expand upon that a little more and how the state is preparing for this May 15th launch date. I believe it's May 15th, or is it May 15th?
11th.
May 11th. Sorry, thank you. For the May 11th launch date. What is the state doing to prepare for that date? And is the state essentially ready for that?
I think we are. We were on the call this morning. They've been working tirelessly over the weekend and last week. We're calling it a vaccine exception. I know there will be an inclination to call it a vaccine passport. I don't feel that strongly about it one way or another. People have been getting vaccines for decades and decades to participate in public education, being in the public schools, travel to many different countries. This is a much simpler thing. If you get vaccinated completely with the 2 shots from Pfizer or Moderna or the 1 shot from Johnson & Johnson, and then 2 weeks pass, a full 14 days pass, you'll be able to simply upload your vaccine card into the Safe Travels website, and we will verify it. The verifying software is ongoing. They're working that up, or we'll also look at the card when you land, and that'll be it. You'll be safe. You also might note that Europe announced today that they intend to allow travel from the United States if people are fully vaccinated, again, with the same criteria, fully vaccinated, the 2 shots plus your 2 weeks, or Johnson & Johnson plus 2 weeks. Those individuals are going to be very low likelihood as far as spread of COVID goes, very low likelihood. And that's why we can move forward. It's going to work for us here for inter-island travel. And I hope that we will follow not too long after with travel from the mainland, provided people can demonstrate that they're vaccinated. I don't think we should be too uptight about it. I think it'll be a very low number of people that are trying to defraud us. There's already a lot of interest in traveling back to Hawaii. And this is in many ways a safe and ultimate way to guarantee that your case counts will be low. We've had the pre-test program. Safe Travels been working great. It's kept our numbers utterly low. But why would we get people vaccinated if we weren't going to trust it? It's pretty obvious. So that's all getting put into place. May 11th is Jamie's birthday, and I'm excited to see that. We're going to celebrate both inter-island travel with your vaccine card, and we're going to have cake at home.
Let's clarify one thing though. If you are coming from the mainland, you're coming from California. Let's say you stay on Oahu for a few days, and then you want to go to Kona. You still have to get that. If you're not a resident, you'll still have to get the pre-test. Is that correct? And why not open that up to trans-Pacific travelers as well?
Yes, at first you will have to be from here, and you will have had to have gotten your vaccines here, because that's what we can verify. The good news about that, though, is that once we do open up travel from the mainland with this vaccine exemption, then we'll be able to also hopefully use our own residents at first, because once again, we will still be able to verify that they had their vaccine here in the state of Hawaii through the VAM system, that's the vaccine management system, or our partners at Queens and HPH and so on. So that should be very good for us. It won't start right away. We're going to get this going first and do it for at least a month from May 11th on. But I will be working very hard to convince the Gov that once we can just adequately verify that people have gotten their vaccines appropriately, that we extend it. It's really going to be the way of the world. Also remember that not just us, but the whole world come July and August I should say the whole continent, all of the United States, will have reached these large numbers of vaccines being completed. We know that in some countries around the world, like India, they're going to be way behind. Japan is actually behind. But U.S., mainland, and Hawaii are going to have most of our people vaccinated by the summer. And that will mean that the strong majority of people traveling here will have been vaccinated. And so I think we should trust their cards and do some verifying and be safer as we see the numbers go up. I can tell you, forgive me. Just that last little thought. Sorry for rambling on. The numbers are really going up for people traveling, and the bookings are going way up, which will restore jobs and it'll be safe. People will be vaccinated, but the numbers are going to be large. And as we get through this crisis, people will go back to work, but we'll have to start focusing on a lot of other, economic activity for ourselves if we don't want to fall into the same old patterns.
Let me just clarify one thing. So right now we'll open up to inter-island residents only with verified vaccine. Do you foresee the next step then being Hawaii residents only for trans-Pacific travel, since that system you can already verify that, and then going to people from, the rest of the continent?
That's a great question. That has not been determined yet. That makes the most sense. Hopefully, though, we will be sophisticated enough by a month or 6 weeks out that we will not have to even distinguish. We're not allowed to distinguish between Hawaii residents versus mainland residents for travel from the mainland, but we are allowed to make the distinction about what we can verify. And if the only thing that we can verify is individuals who got vaccinated in Hawaii, that would be our standard, which would actually benefit our local residents coming back from trips on the mainland, because we'll have that in the system. We'll be able to verify it, and they could travel with this vaccine exception. I won't be surprised if that's what happens.
And what is the timeline, you think, for the international flights and visitors for those who want to travel abroad internationally? Same regard with Hawaii residents traveling internationally, or international visitors?
So this is just a ventured guess, okay? But my best guess right now, is May 11th for us for inter-island travel, around July 6th, right after July 4th weekend for mainland travel, provided we do a good job with verifications, and then perhaps Labor Day for international travel. But that's a lot of ifs. The Gov has to be comfortable that international travel has been made safer. It is, though, very promising that Europe is moving in this direction, that the European nations are going to have a process by which people can, they're calling it a smart card, verify that they were vaccinated. I know that this does get some people upset because they feel that they're being treated unfairly, that if they haven't gotten a vaccine, they won't be able to travel as freely. That is not the case. If we want anyone to travel, they can simply get the pre-test still, and we'll try to make that as smooth as possible. We're not going to take away that program. We're going to keep that in place so that everyone has that opportunity, because I know some people just simply choose not to be vaccinated. They have either health problems or they have some kind of philosophical objection to it. So if we get act together continuously. It's May 11th, sometime midsummer, I think right after July 4th, and then the end of summer for international travel.
Ryan's got a question here. What happens if we don't reach herd immunity due to people who are anti-vaccine? Not necessarily even anti-vaccine, perhaps, vaccine hesitant specifically when it comes to this one. The University of California and the Cal State system announced just last week that they are mandating vaccines for all students and employees in California. That takes care of 1 million people in that state. We understand, is considering something similar, though that's not, that hasn't happened. The hospital systems, as we understand, in Hawaii are also looking at that, requiring vaccines. What's your thought about vaccine mandates to help us get to that herd immunity?
I can speak only for myself. I do not personally support vaccine mandates. I just don't support them in this circumstance. I'm completely pro-vaccine for myself and what I recommend as a doctor. But a vaccine mandate under an emergency use authorization is something that's going to, number one, create a lot of conflict and possibly have exactly the opposite effect that we want, which is to get more people vaccinated. I think people should do it willingly. We will have a lot of immunity. If the question is what happens if we haven't gotten herd immunity, then unfortunately, the people that refused are going to be vulnerable. They're going to be vulnerable to catching the virus, whereas the rest of those who did get vaccinated are going to be quite safe. And I really would, I'd be sad if some people were vulnerable, especially because some young people will still be vulnerable because they can't get vaccinated, although they're not getting very sick, so that's okay. I do think we will reach herd immunity. We'll reach herd immunity one way or another. This is how we'll reach it. Under that circumstance, say we got 65 or only 70% of our people vaccinated, the rest of the herd immunity will be achieved when 100,000 or 200,000 people either get antibodies or catch COVID. And that's how you get to herd immunity. That would be the last bit. But we are right now on target to actually get there through the vaccine, plus we're at just under 32,000 cases confirmed in Hawaii. So we'll get there. It's a big challenge, both philosophically and medically. I really don't think it's traditional or typical for Hawaii to force people to do things like this. I would rather have us come to the conclusion through the coconut wireless and through good public health that we just get 80% of our people on board, and the last 20% of the people just assess over time whether they want to change their mind and get vaccinated.
We know that the CDC is working on revising some of the earlier recommendations that were put out at the start of the pandemic regarding mask wearing, wearing masks in public. In fact, Dr. Fauci alluded to that yesterday when he made a comment about potentially not having to wear masks outdoors anymore because the likelihood of those who are vaccinated and being outdoors, it is very rare that anyone would get the COVID through that, being outdoors. Well, what are your thoughts on rules and recommendations that may come out that may change that? Are you afraid that that could create some misunderstandings and further clarification that the state will need to then follow up on?
Yes. Whenever the CDC recommends something, people think that might be already a national policy. Usually it's just guidance that they give. I do think that this will be one of the large policy debates that comes next, which is, do you or don't you have to wear a mask when you're outside? The smartest thing would be to wait until we do reach herd immunity or functional herd immunity and then back off on some of those restrictions. Least risky place I can tell you to catch COVID is outdoors in the open air. So we already know that if you're out exercising by yourself, you're not going to make any difference as to, the spread of COVID, whether you have a mask on or don't. If you're out and not around anybody, it's just not a risk. Eventually, the policy will change that people who are outdoors and are vaccinated certainly do not need to wear masks. It just will not make, any impactful difference. But for now, it would be good to get to herd immunity or close to it before we make those changes, because everyone will then say, well, I was vaccinated. And I don't think we want to be, too overly focused on policing this. I think it's better to know that our society at large is basically safe. We'll see cases come way down, which means the viral load in society will be much, much lower, harder to catch COVID. And then it won't be a big deal at all to have outdoor events. Keep in mind, no matter what the government says or I say or your doctor says, no matter what, you are safer with a mask on, especially if you've not been vaccinated. You are much safer. Once you are fully vaccinated, if you're around other people who are fully vaccinated, you aren't at much risk. You're around strangers, you just don't know whether they've been vaccinated or not. And that should be your consideration. You should assume that they are not immune yet.
There's a question here from Karen. She says, what about kids 15 and under? Do they need a COVID test to go inter-island if both parents are fully vaccinated? I know you mentioned that you think 12-year-olds, 12 and up will be the next sector to get that approval. But in the meantime, what does a parent immunity, like who does that extend to if they're traveling as a family?
Yeah, they'll have to get pre-test for now. We haven't changed that policy yet. That's why it's going to be nice when we get 15 to 18 or even 12 to 15 onto the vaccine plan. I think a lot of people are going to choose for their adolescents, teens to get the shot. I know that ours is. I know that Maya is going to get vaccinated. She's 14 years old. So as soon as that becomes possible from age 12 to 15, I think it's going to be the Pfizer. She'll get vaccinated. Until later, we're going to continue with this plan where you simply get the pre-test and you can travel. But over time, I also like to drop that provision. These are discussions that have been going on periodically, but we're singularly focused on two things right now. So, one, getting everyone vaccinated, and two, making sure that the vaccine exception is pretty simple and straightforward.
I had a follow-up question on the Safe Travels program. There are some individuals who are taking the pre-test and are deciding to go into quarantine and quarantine for that time being when they arrive to the state. Is the state still following up on those individuals? How is that process moving? And has anything changed through this process of making sure that those individuals who aren't getting the pre-test, that aren't cleared to be all out and about, are they still being followed up on to make sure that they are in quarantine?
They are, but it's an imperfect system. There's only so much resource in the Department of Health. Whenever there's an outbreak, they have to chase down a lot of extra contacts. There's no question that the focus has been on vaccinations and tests at the airports and tests for travel. So there's a lot of basic trust that has to go on. But surely if someone has not been vaccinated and they're a traveler, they're going into quarantine. They can't get a rental car. That's very difficult for them to get into a hotel. So that usually takes care of itself. And a lot of people are going home when they realize they're not going to be given some kind of exemption. For our own local people that return, we have to trust that people are putting others' interests with theirs. They have to know that if they've come back, for instance, several of the cases that we've seen lately have been people that live here and have been traveling. And they said they went into quarantine, but whether they did or didn't, they may have infected some of their family members. So again, the gov has been pretty clear, and I feel the same way. Don't take extra trips to the mainland that are unnecessary until you've been vaccinated. It's just not in your interest. And certainly get tested when you come back. That 72-hour pretest is pretty good. It's lowered the case rates by over 80%. I think it was 88% reduction in cases as a result of having the PCR test. So all of these are, good, solid protections, but not 100%. Same can be said of policing this stuff. It's pretty good. You get a lot of calls. You can get some spot checks at people's houses or at parties, but the police are pretty occupied with all sorts of other work. So it's difficult to enforce these laws.
Our time runs out so quickly when we spend it with you. We appreciate it. We've got about a minute left. Just want your closing thoughts as we start off our week.
Sure. My closing request, humbly, is everyone, if you have not yet been vaccinated, please do get vaccinated. There are a lot of people who have been described as hesitant, but they actually are eager or willing to get vaccinated. They just haven't gone and signed up yet. Please do that. There's some places you can sign in, walk in. If you're having any difficulty whatsoever, call 211. That'll get you to some help, and they'll help you sign up. Go to the hawaiicovid19.com website, go to CVS or walgreens.com and sign up. But please get your vaccines. If we could get through these last 800,000 shots, all of these questions would be moot. We will not see almost any spread of COVID, almost any hospitalizations, and we will feel safe as a society to open up and return to normal. So please, if you don't mind, as long as you're not philosophically opposed, go get vaccinated in the next couple of weeks, and Hawaii will thrive again. It's already amazing to see how fast our recovery has begun, but in order to completely recover, we're going to have to be immune as a society.
All right, Lieutenant Governor Josh Green, thanks so much for joining us this morning and for updating us on everything that's happening so far already on this Monday morning. Thank you so much.
You bet. Have a great week. See you later.
Aloha. Well, Ryan, we covered a lot of questions there from our audience about the Safe Travels program and, those exemptions that they're working on. They're still really working through it, but interesting to note that it could be a tiered system. It sounds like, they're starting May 11th with Inter-Island. Then we could see trans-Pacific travel allowances for people in Hawaii. And the main reason for that, as he said, is just that that's the easiest for the state to verify. All the states sort of launched their vaccine programs and they all did it a little bit differently. So it's very difficult for the state of Hawaii to do that. But eventually we will get there, and we could get there on a national level, of course, because as the Lieutenant Governor said, the European Union announcing today that they will accept travelers from the US as long as they have verified vaccines. So it'll be interesting to see how internationally they do that. That could help us figure out how to do that here.
Yeah, and also he's confirming and reiterating that those who, of course, did not get vaccinated will have to still continue on with the pre-test program or go into quarantine. And for children, again, they will unfortunately have to take the tests, pre-test, even though their parents may be vaccinated. So we know that that is also going to be something that families will have to organize through and plan out as they tend to, of course, travel together, but knowing that their children will have to go and get a pre-test even though parents are vaccinated. Also hearing from the Lieutenant Governor about his thoughts on the Johnson & Johnson vaccine, saying that he recognizes that there may be some hesitancy for individuals to want to get the Johnson & Johnson vaccine now that it is available once again, but saying that people will ultimately have the decision to decide which vaccine they want to take if they so choose to get vaccinated.
Yeah, and really you heard him there pushing folks to please, if you are eligible, to sign up. Anyone over the age of 16 across the country eligible to sign up now. Sounds like they have plenty of doses. It's a matter of trying to get all the slots filled. And he said, one way or another, we will reach herd immunity. It's just a matter of, do we get there through illness or do we get there through vaccinations? Some bright spots, though, that Lanai, Molokai, and Kauai are going to be among the first, if the first two have almost reached it already, to get to herd immunity. And he anticipates that if we stay on the pace we're on now, we could get there as a state in just 8 weeks.
Yeah, well, looking forward to that, of course. And we're seeing a lot of comments about the tier system, about certain things being adjusted with group sizes. Those are questions that we would like to pose to the mayor, who ultimately decides on the tier system and its structure. So for those of you who are asking questions about that tiered system, we're actually going to be having Mayor Blangiardi here on this program on Friday to discuss some of those changes and proposed changes that could happen to the tier system as the state and as the island enters into these herd immunity phases, if you will. What kind of changes the city plans to do that? We're going to have, again, that conversation on Friday. But on Wednesday, we have another important topic that we're going to be discussing.
Yeah, we saw a lot of you writing in about unemployment. We're going to be talking about the economy. Yuhiro Carl Bonham, professor at University of Hawaii and economist, is going to be joining us to give us an outlook there, along with Bob Harrison, who is the president and CEO of First Hawaiian Bank. We wanted to get sort of, that perspective to say, as a lender and as someone, obviously a large financial institution in our community, what kind of transactions is he seeing? What are the businesses that are hurting the most? Also asking them some questions about the real estate market, because we know that is exploding right now with very limited inventory and houses selling very quickly with these low interest rates. So we're going to be getting a broad picture of Hawaii's economy and the recovery. That'll be Wednesday at 10:30, and we do hope you'll join us then.
Until then, take care, and we'll see you right back here on Wednesday at 10:30. Aloha.
Aloha.